Okay, well, hello everyone. Welcome to this evening's meeting. I'm Dr. David Ajibade in for Dr. Mercy. Dr. Mercy she's on night duty this week, I guess. So, honored to host in her stead. Okay, if you are on, please let us know. I'm going to give it a few minutes while people come on. And if you're on, please just go ahead and type a comment there saying that I am on. Let us know where you are calling in from or where you are logging in from, and your name, and we shall get started shortly. Today is going to be an interesting topic: vitamin D3, the female brain, and dementia. And I was on last week. Some of you saw me. We talked about a few things a few reasons why women tend to have higher rates of dementia than men do. And interestingly enough, hey Camilla, welcome. Hello. Hey Bonnie, Lisa from California. Hey Bonnie from New Hampshire. Thank you. Looks like a lot of people are coming in from on LinkedIn. That's really interesting. I would have thought maybe Facebook or Twitter. Hey Vet. All right. More and more people coming in. LinkedIn is big, really. So Facebook is also available. Hey, Henry, welcome on. So we are talking about dementia, but we're also going to focus a lot about vitamin D, the female brain, and memory loss and other dementia and other related conditions. If you remember, we talked about why women tend to have higher rates than men when it comes to dementia, twice as high. And I was about to say that the first ever recognized diagnosed patient with dementia was actually female. So it's kind of like it fits the pattern. And one of the top things that we talked about is that women tend to live longer than men. Yay. We talked about some things like the hormonal imbalances. We talked about stress, how women tend to process stress more than men do, more sensitively than men do. We talked about sleep. Women have more sleep problems than men. We also talked about autoimmune conditions. Women again have higher rates of autoimmune conditions than men do. Digestive issues too, as a factor over time, can actually predispose to dementia. So there are quite a few reasons why women tend to have more higher rates of dementia than men. And when you compound that with the fact that Black women being Black also doubles your rate of dementia compared to whites. Come it. I don't know why this is always happening, but but that's what we're having. That's what we have to deal with, and so we need to know exactly why we have such higher rates. That's Black people, and of course, women now have a step higher. They have higher rates than men. So we need to know exactly why, so that in each scenario, in each situation, we know what to do, whether it's when we're eating, when we're preparing food, whether it's when it comes to exercise, when it comes to lifestyle factors, when it comes to work, when it comes to travel, when it comes to sleep, all those specific areas. Yes, menopause. Beverly says, is menopause a factor too? Yes, indeed. And it's a factor because of the hormonal imbalance. We know, for example, that estrogen, the hormone, is not a female hormone because men have estrogen as well, but it's more abundant. There's higher proportions in females. Estrogen is one of the most important hormones to protect the brain and also to improve brain function. I'm hoping I'm going to be able to get into that a little bit as we go along. So with menopause, there's a significant drop in estrogen. And that drop in estrogen makes it so that your brain does not have as much estrogen to protect itself as it did before. And if you remember, last week, we said there are only three reasons why people tend to get dementia. One, greater attacks and over a longer period of time. So this is a question of the duration and the severity of the attacks on the brain. I don't have time to discuss it today. You can go to our YouTube channel and we kind of like break it into small bits and we discuss each one as we go along. So yeah, I might as well just type in our YouTube channel here, because we really have we're really focused on addressing dementia, especially in blacks. So there's a specific channel that's focused on dementia and blacks. So you feel free to go on. I've typed it in. It's Dr. David. My last name is Ajibade. It's right there, Dr. David Ajibade. But it is Dr. Since Dr. David Ajibade. That's the YouTube channel. So you can subscribe to that YouTube channel. Information there is free, obviously. So one is greater attacks. Two, fewer defenses, fewer protections. And again, estrogen helps to protect against dementia and memory loss. And number three, make sure I get it right. Number three, no, we don't want the wrong finger going up. Number three is when things begin to slip, memory loss, problems with processing information, problems hearing, people, when things begin to go south, they don't get adequate, appropriate medical care promptly. And this could be for different reasons. Some people just don't want to go see the doctor no matter what's happening. Others, maybe it's a question of geography. You don't have access or location. You don't have access to a professional who knows what they're doing, who can run the right tests and say this is what's going on, and they can nip it in the bud. So, but bottom line is that you don't get adequate treatment when things begin to show up, when problems begin to show up. All right. Beverly says previously diagnosed with low vitamin D levels and prescribed prescription strength vitamin D. Now taking OTC supplement. You know what? I'm from Africa. We don't have the luxury of someone prescribing vitamin D supplements for us unless we have really good, unless there's high level medical care. And quite frankly, between you and me, OTC, I get my vitamin D from Amazon, or I go to Sam's Club because it's really cheap. And you can get it's huge bang for your buck. The bottle I have, I pay less than $10, and it's like 400 capsules. So that can last me a long, long time. Yes, vitamin D is one of those nutrients that don't require an extensive, elaborate treatment and purification process. It's very easy to make, very cheap to make. Thank God for that. So I really encourage people to get it. And sometimes what the doctor prescribes for you, I'm going to be frank with you, is not even the right kind of vitamin D. It's vitamin D2, which is even more expensive, and it has a higher risk of toxicity than D3. D3 is more natural, is more bioavailable, so I would strongly recommend D3. I use Swanson. Sam's Club has his own brand, so you can use that as well. All right. So let's see if I can share my slides, because I have a few slides I would like to share. Let's see if we can do that. Man, I should have gotten some tutorials from okay, share screen. Hang on just a minute. Okay. All right. Let me know if you can see my screen. That's not what I want. Okay. No, I want a window. Yeah, there you go. Can you? All right. Can you all see my screen now? All right. So I'm gonna stop here. Let's see. Okay. Let's see. Someone says yes. Okay. Gina says yes. Beverly says no. All right. Can you see my screen now? Okay. Tash. Okay. Good. Excellent. So I'm going to assume everybody can see my screen now. Like I said, I wish. Okay. I'm going to just say a few things, and I'm going to go back and see if you guys will see watching my screen, because right now I can't see my dashboard at all. All I'm seeing now is my slides. So maybe I should just check. So let me know if you're seeing vitamin D3, your brain, and Alzheimer's disease. I'm going to switch back in to my dashboard and see if you all are there. Okay. So, all right. So you can see better. Were you able to see? Okay, so you were able to see the main screen. Okay, so I'm going to switch back, for a while. And for a while, I'm not going to go back here. So I'm going to assume that as I'm sharing the slides, I'm going to assume good. Thank you, Shuri. I'm going to assume that you guys are watching it, watching my screen. Okay, good. So you're seeing Brain and Body Foundation. Okay, there you go. So I run the Brain and Body Foundation. It's based both in Africa and the US, Nigeria specifically. And our goal is really to address and to teach, to share information, help people take better care of their brains so they don't have Alzheimer's disease. It is growing rapidly around the world, especially in places like Africa. All right. So I'm going to talk about I'm going to rush over these slides real quick, but just wanted to, I really want us to have the basics in place. There are seven functions of the human brain. I start with speech because that's what's probably more than anything else separates us from the beasts and the animals. Number two is cognition or reasoning, the ability to think, imagine, process information. Number three is emotions, the ability to process and express emotions. Number four is movement, whether it's movement with my fingers or movement within the body, and those subconscious movements, digestion, for example, getting things moving through the body. Number five is memory. Of course, some say that's the archetypical, the prototypical function of the brain is memory. And of course, the subconscious processes of breathing, cardiovascular health, blood pressure, that I mentioned digestion earlier, sleep, all the things you do in the bathroom, and so on and so forth. And of course, the brain processes information coming in from the outside. So information within and without. And this is a really overview of what happens in the brain. But the way the brain functions, the main way the brain functions is, as you can see this is the full picture of the brain. To the right here, you see this is the basic unit of brain function. It's called a synapse. You've probably heard it before. Information has to pass from the top neuron. The neuron is the brain cell. For anything to happen, whether it's me moving my hands or thinking, any of those processes that we mentioned, whether it's speaking, anything to happen, it has to happen through the communication of signals called neurotransmitters or neurochemicals from one brain cell to the next. That's what a synapse is called. This is the basis for everything in the human brain. Everything the brain does, it has to do it at that basic level. Here's another picture here. So what does the synapse need? What does your brain need to do what it can? I'm not going to talk about the nutrients because that's probably another topic. Again, you can go to our YouTube channel and watch it on our YouTube channel. We talked about several things the brain needs. I'm not going to talk about it, like I said. But what I'm going to focus on is what I call the supporting cast. And I think this is something that I want to be careful the way I say this, but neurologists and specialists who deal with the brain, they tend to look at the brain. Many times they don't think about the supporting cast, the other systems that are very, very important that really, really exert a huge influence on the brain. Many times they just refer to another doctor to take care of the other things. I think that's a mistake. I think neurologists and people who deal with the brain should understand how the other systems affect the brain and how to influence those other systems. So I have it here. So your thoughts and your emotions. There are three systems. We have about 12 systems, but there are about three that stand out. The nervous system, represented by the hypothalamus, the endocrine system, which is your hormones, estrogen, progesterone, thyroid hormones, so on and so forth, and the immune system, which of course we all know. I mean, if you went through COVID-19, you know a thing or two about the immune system. So I'm going to talk about each of them a little bit, but these are just pictures. The immune system, believe it or not, the immune system has a huge role on the brain. In that picture, I did not mention the cardiovascular system, which is the blood flow. Of course, your brain needs adequate blood flow. It needs to have lots of oxygen, lots of nutrients, lots of energy. And the cardiovascular system is responsible for that. Now, where does vitamin D come in? I'm going to talk about vitamin D3 going forward now, because it's not just, I think sometimes we just gloss over it. And I think that's a mistake, especially for what we Black people. We are now finding out more and more that if you are low in vitamin D, it will affect your cognition, your thinking, your reasoning processes, your memory, and a host of other things. If you are low in vitamin D3, you may not see the effects right away, but it's going to build over the years and the decades. It's going to compound. Almost everybody with dementia had previously had persistently low levels of vitamin D. So there is a well-established scientific fact now. There's a well-established link between vitamin D deficiency and impaired cognition, or the ability to think and to reason. Again, Black people, we have the lowest levels of vitamin D. So if you're hearing this for the first time and you're over 40, maybe even over 30, if you're hearing this for the first time and you're over 30, there's I would say, a 95% chance that you are low in vitamin D, because we're in the winter, and if you're in the US, especially in the East Coast, you are not making vitamin D from the sun. All right, so I'm just going to read this out real quick. Recent studies have confirmed an association between cognitive impairment, dementia, and vitamin D deficiency. A growing body of literature also suggests that higher levels of vitamin D, either in utero, that's in pregnancy, or early life, may reduce the risk of autism, even autism. Indeed, vitamin D was reported to modulate the biosynthesis, big words, of neurotransmitters and neurotropic factors. Moreover, its receptor was found in the central nervous system. Vitamin D deficiency was therefore assessed as a risk factor for the multiple diseases aforementioned. So there was a lot that came before this. I just took this out. Let's go over some of the main things vitamin D does for the brain. I'm going to switch back out and just make sure. Hang on just a minute. Tell me you are seeing this. Were you guys following? Okay, so I guess everybody is seeing this so far. Okay, good. Okay, just tell me real quick now if you are following me as I was going through this. Tian gives me the thumbs up. So I guess that means that you were. Just okay, let me have somebody else actually say something or type something. Yes, okay, good. Thank you. All right, good. I'm going to go back to, I hate talking. I hope you can tell that I hate talking to myself. Okay. What vitamin D does for the brain, I hope you can read this. It helps in protection. Remember, the number 2 thing we said is that there are 3 things: greater attacks, fewer protections, and then the third one last week, like we discussed. Vitamin D protects the brain throughout life, especially the part of the brain that has to do with memory, which is the hippocampus. But in addition to that, it helps in the production and the regulation of those chemicals, those neurotransmitters, especially things like serotonin and dopamine, which you probably heard about. And we'll get back to that later. It helps in the production and regulation of hormones, including estrogen. Remember what we said. Estrogen is one of the most important protective factors for the brain. The advantage we men have is that we can convert our testosterone to estrogen because we have higher levels of testosterone. Women cannot. They can, but they don't have enough testosterone to shunt over into estrogen. So when they hit menopause, they're pretty much run out of estrogen. It's so low, and especially if you've had surgery or you remove your ovaries and your uterus, that also compounds the fact. All right, it improves memory. So vitamin D again improves and maintains memory and cognitive function. It helps in early childhood. So if there are any grandparents here or mothers to be, one of the very best things you can do. Very best things you can do is start supplementing right away. Don't wait. Well, okay, I have to say you have to go check with your obstetrician or your doctor, but trust me, you need to have your vitamin D levels optimal, not at the low level of normal. I would recommend at the high level of normal, which is closer 70, 80 and above. I know you're going to say this is dangerous. You can check with your doctor, but this is for my patients because I still run a practice. I always recommend higher levels that you aim for higher levels of vitamin D. And back to the hormones, by the way, they're finding out that for people who are menopausal, I mean, in fact, for anybody, for women in particular, but especially for women who are menopausal, they say you should have, doctors say you should have 70 nanograms per mil, because it's measured in ng ml. So it's from 30 to 100 is the range that is acceptable. That is the official range, 30 to 100. Don't accept 30. Please do not. Don't accept, don't accept 40 or 50. They're finding out that 70 is at 70 that you're able to make the levels of 70 vitamin D levels that you're able to convert to make more estrogen, or your body's able to make more estrogen at 70 and above. So I know this is new, this is strange. You are not there's no one who has died from excess of vitamin D, I can tell you that. And 70 will not kill you, I promise. All right, the next thing is brain development and plasticity. It also regulates mood and sense of well-being. So think mental health. I guarantee you, the majority of people who are suffering from mental health problems have low vitamin D. Some of you may not be hearing that for the first time. All right, so vitamin D and memory. I'm just going to read this out. This man, Gazen, whatever, conducted a study which shows that vitamin D regulates the release of nerve growth factor, NGF, an essential molecule for the neuronal survival of hippocampal cells or hippocampal neurons, as well as cortical neurons. Bottom line, the parts of the brain responsible for memory and for higher functioning, the things that make you human, needs vitamin D, needs ample amounts of vitamin D. All right, so we talked about the general things that vitamin D does. Now let's talk about what vitamin D, where the supporting cast is concerned. So I've listed them here. Vitamin D helps with the hormonal system, with the endocrine system. I just mentioned just now that you need high levels of vitamin D in your bloodstream for pregnancy, for production of estrogen. Again, this is especially for women. You must have good enough levels of vitamin D. I cannot emphasize that enough. Sometimes I feel to myself, I think to myself that I'm overdoing this, and then when I go somewhere and I read something else, or I hear something else about vitamin D, and I'm like, gosh, people don't know this, so we've got to tell them about this. So yes, at the risk of sounding like a cracked, broken record, yeah, that's the term. The risk of sound like a broken record, I'm going to keep on saying this because a lot of people are still not doing this. A lot of Black people are still not taking enough vitamin D, and you're not getting out in the sun either. Even if you did go out in the sun in the winter, you're not going to get anything from the sun because there's something about the tilt of the earth that makes it hard for you to make vitamin D. And you've got to expose your skin to the sun. So during the spring and the summer, when the sun is out like it should be, you've got to expose your skin. It's not you're not going to get any vitamin D just going out the way I'm dressed. And people think that having enough heat means that you have enough vitamin D. You have to have complete exposure of the skin. Nothing in between your skin. No window, no mirror, no glass, no nothing, no clothes. The only way your body's going to make vitamin D is when it is exposed to the rays of the sun. All right, let's go back to what the supporting cast. In the immune system, vitamin D helps with the immune system. It's known vitamin D is an anti-inflammatory. It's also an antioxidant. But most important, what it does is it helps the immune system function like it should. What happened during COVID for a lot of people who are low in vitamin D is that their immune systems overreacted to, and I'm just giving you those the thumbnails now, the basic things. What made it so severe in many people who died and who had severe or who are still suffering from it today is that the immune system overreacted to the virus and caused what it could be. I mean, the official term was cytokine storm, but was more like an autoimmune reaction in which the immune cells were attacking parts of the body, including the blood vessels, including the lungs, including the digestive system, triggered by the virus. So what vitamin D does is that it helps to modulate, it helps to calm down the immune system. It makes the immune system more up. It makes the immune system more targeted in its strikes. It calms it down when it needs to calm down. It revs it up when it needs to revs up. And once it's done its job, it calms it back down again. That's what it could not do with the COVID-19. The COVID-19 virus just reared it up and kept it revved up, kept it ratcheted up, kept it riled, so to speak, against the virus, and that caused problems for the body. All right, I'm going to move on. The vitamin D is also important for the cardiovascular system. Many people who have very difficult hypertension, maybe they're on 3 drugs, 4 drugs. We know that the immune system, the vitamin D can help in that. I have patients who are on like several drugs. They're still not able to maintain their blood pressure. We added vitamin D and a few other supplements to a few other nutrients, and their blood pressure maintains while they were still on the drugs. Don't hear the wrong thing. They needed to be on the drugs. You have to be on the drugs for your medication for hypertension and diabetes or whatever. But this helped make the drugs more effective. Vitamin D is super important for blood flow to the brain and within the brain. Vitamin D, you've probably heard about leaky gut. Vitamin D is important to help to seal the guts and make the gut healthy. Vitamin D is important for the health of the good bacteria in the digestive system. So it helps with digestion. If your digestion is compromised, you're also going to have problems long run with the brain. I mentioned musculoskeletal system because we're now beginning to find out that stronger muscles, having good, strong muscles, good bulk, is important for the brain. Having active muscles, you're not a couch potato, is very important for the brain. We can talk about that later. Again, if you can go to our YouTube channel. Just once you go to our YouTube channel, you can actually subscribe so you can get notifications and so on. So you know how that works. But we're going to be addressing so many of these topics. And of course, last but not the least, detoxification. Your brain needs to detoxify, your body needs to detoxify, and that's how it keeps itself clean. Vitamin D is important in that. So you can see vitamin D is important in several different aspects. It's people who have, I mentioned before, people who are depressed and anxious, almost 99% of them will have low vitamin D. I mentioned vitamin D and menopause. So you've got to maintain healthy blood levels. I've already told you, I mentioned that 30 to 100 is the range. I would say aim for 60 and above, between 60. I checked mine last year, it was 83, and I'm still alive. Doctors who know what they're doing, who are treating dementia, do not accept anything less than 100. That's for people who already have dementia. Remember, the range is 30 to 100. So I have no problem about encouraging people to have optimal levels of vitamin D. Okay, I'm going to leave you with this this slide, this picture on the slides above. These are mice. I know we are not mice, but we can certainly take lessons from what the studies that are being done, from the studies being done with mice. Above, you have 2 mice. They are pups. They were born the same day from the same litter. Then about 4 months or 8 months, whatever, sometime afterwards, the mouse or the pup on the left, which is called a vitamin D knockout. That's the KO, and knockout mice. This mouse is unable to make vitamin D, and you can see that this mouse, he or she, looks shriveled and weak. Doesn't have much hair there. I mean, just looks old. On the right, the normal mouse, you can still see the nice silky skin, chic sheen. The hair, whatever, fur is looking great, looking very healthy. So you can see that over time, low vitamin D levels ages you faster. Now, I know black don't crack on the outside. But if your vitamin D levels are low and you're black, and most of us have low vitamin D levels, especially in the winter, your body's aging faster than your white counterparts if your vitamin D levels are low. So you cannot afford to leave this to chance. I hope some of you listened to me last week. I hope you've you've checked your vitamin D levels and done the right thing, so to speak. All right. So I'm going to get out of here now, and then get back to looking at the pictures. Okay, great. So how are we doing so far? What do you guys think? Did that make sense? Did I scare you? I hope I did. Just kidding. I don't want to scare anybody. Okay, stop sharing. We'll stop sharing now. Okay, good. Okay, let me read through some of your questions so far. Same here, baby. That's me. I several blood pressure medications. Okay. All right, let me see how I can get back to the first. Okay. I'm going to start. If I missed something, I want to start with. Okay, somebody said vitamin D. You didn't put your name, but you said vitamin D gave me my life back. Wow, that says a lot. Okay, so I'm going to start with that and go down from there. There is a vitamin D. Cherie Wright says there's a vitamin D test that you can do at home to check your levels. I did not know you could do a vitamin D test at home. Can you share what that test is? I would love to see it. Oh yeah, Gina's asked. Okay. All right. Okay. Clearly, Alexis is not talking to me. Thank you. I take 50,000 international units per week. Okay. Vitamin D pills better than gummies. I believe you said yes. I use Swanson. Swanson is one of the ones I use, and also vitamin D3 Sam's Club. Hello, Lady Andrew Vaughn. Okay. So how do I get my doctor to up my dosage, which is currently 1.25? You mean micrograms? How do I get? Valerie says, how do I get my doctor to up my dosage? Well, you need to talk. You need to talk to your doctor about it. I mean, once you test, you got to test yourself and then see if you. I've kind of like explained that if somebody says, how do I get my doctor to up my dosage, which is currently 1.25 milligrams? For my patients, I recommend at least 10,000 international units during the winter, especially. So if you test yourself, because your doctor's not going to do anything unless you test yourself. I mean, unless you get tests. So based on the test, you can now have a point. You can now make your point before your doctor. Thanks for sharing. Will you share this on Sandra's Authors Forum talk? Yeah, Sandra, I don't know how this works, so maybe you can ask Dr. King or Dr. Mercy. Okay, Pauline, thanks for sharing. I received my lab results and no one provider has explained it's important to me before today. Okay, well, glad I could help. Just took my vitamin D. I am postmenopausal. Gina, good for you. Jen says I'm running upstairs to take mine. Yes, stick with it, not just today. Why does insurance refuse testing? How can we have this added to the routine test panels for annual checkups that insurance will cover? I wish I could tell you. I don't practice. I mean, I'm not licensed in the U.S., but I do have patients that I consult with online over here. So maybe this is a case for you to take to your state senator or your state congressperson. What is the best sunscreen for Black people when fully exposed to the sun? For a while, I didn't think Black people got sunburnt. I thought that we were protected from those things, unless in severe cases. I mean, I've been sunburnt. I've had sunburn once in my life, and that was when I was in the military, and they were punishing us. So we had to take we had to expose our chest to the sun, and we were. It was brutal. But I've come to understand that people are different. Some people get sunburnt very easily. So what is the best sunscreen for Black people? I gotta tell you, you would have to do your research, Anita. I don't know. I honestly didn't think Black people needed sunscreen before. So I just took mine in a multivitamin form. Hope that's enough. My experience with multivitamin forms, they don't have enough vitamin D. That's my experience. Because you got to pack a lot of different things into one small pill, so they just take token amounts and put in the multivitamin, If you're not making, like I said, this is winter. I recommend for my patients 10,000. You can do what your doctor tells you to do, but I'm not going to tell you to take 10,000. I tell my patients to do that. You get it? All right. Okay, Sandra's giving me yeah, I can't do anything, Sandra, with this. You would have to get with the doctor. Gray Cooper. Someone's tells. Okay, all right. Okay, this okay. All right. I take 2 soft gels a day. That's 1,000 international units each. Okay, so I guess that will be 2,000. Gina said it takes about 2,000. If you're over 40, and you're black and you're overweight, which is a lot of us are. I'm technically, according to the BMI, I'm meant to be obese. In my opinion, 2,000 is not enough if you're black, but that's just me. How much should we be taking? Is it age related? Yes. Well, if you're over 40, I tell my patients, if you're over 40 and you're black, and if you're over 40, you're black, you're female, and you're dealing with any kind of health condition, whether it's diabetes, pre-diabetes, whatever, hypertension, whatever, you even need more. So it begins, the needs compound after that. Okay, how much is it? Is it age related? I mean, so okay. Beverly says several blood pressure medications. You might be low in vitamin D. You also might be low in. She's on several blood pressure medications. You really shouldn't be on several blood. Let me be frank with you, because those drugs, those good drugs can have. They're not all just benign. Some of them can break down your system in other areas as well. So I'm not a fan of using several blood pressure medications. It's a good chance you're low in vitamin D. There's a good chance you're low in magnesium. There's a very good chance you're low in potassium. I personally take a magnesium potassium supplement because I'm dealing with blood pressure issues myself. So I take the combination of the magnesium and potassium, and I also take vitamin D. Even if, and quite frankly, even if you're able to control your blood pressure using meds, even if you've got great control, you still should be taking vitamin D, vitamin K. Potassium and magnesium as a bare minimum, because it's not just about controlling your blood pressure. You also have to have healthy blood vessels. The blood vessels have to be healthy, and the blood pressure medications are not going to make your blood pressure, your blood vessels healthy. So you want to nourish and make sure your blood vessels are healthy. My mom is in a nursing home because of dementia. I'm sorry to hear that. Good to know about the benefits and betterments of vitamin. Okay, how many mcgs of vitamin D3 do women in the early 40s need? Well, I kind of giving you the overview. That's a general overview. Like I said, I recommend in the winter 10,000 international units. In the summer, I recommend for my patients 5,000 international units. Bonnie says, try this intramuscular injection, front loads, 1 mil. Okay, yeah, all right. Thank you, Bonnie. I feel special calling someone. Oh my goodness, who is this Gray Cooper anyway? He just keeps on sending messages. Beverly, take my free relaxation class. It will help according to a doctor who is okay. So stress, Beverly, Arlene does some stress management, so that will be good too. Anything that has to do with mindfulness and mental health is great for your brain and for your blood vessels as well. Lee says, good research starter. Having a blood panel done this week. Okay, great. Try to test it. I recommend everybody test your vitamin D levels. Good reminder that about vitamin D being lower in the winter, we need tips to combat that deficiency. The only tip you need is really to take a vitamin D supplement. Do I need to take vitamin K2? Vitamin K2 is vitamin K, the number 2. Yes, I recommend vitamin K2 as well. So there are some supplements that have the combination of vitamin K2 and vitamin D together. What vitamin K2 does that is great is that it takes calcium out of the blood and pushes it into the bones and teeth. Some people, vitamin D helps to absorb calcium from the gut, Vitamin K2 takes the calcium we get from the gut and pushes it into the bones and teeth. Sometimes the calcium can be in soft tissue. Sometimes the calcium could be in the blood vessels. So vitamin K2 helps you take it out of where it should not be and put it where it should be, which is in the bones and teeth. Okay, so more questions about the dose for vitamin D. So I guess I've answered that. Kidney stones. I must take vitamin D3 daily, 1,000 international units. It's just barely normal. Yeah, so parathyroid. Donna is talking about her parathyroid hormones, and she had kidney stones. Okay, so she takes 1,000 international units daily. Okay. Well, if you're dealing with kidney stones too, you got to have be more careful about your vitamin D levels. But I can tell you that vitamin K2, taking the vitamin K2 along with your vitamin D, along with vitamin D, is always helpful. My level is now 76.2. Well, good job, Valerie. That's good. That's a good level. I feel like I am in a funk sometimes mentally. I know I had low vitamin D a few months back, and they prescribed me a very high dose to try and get me to a healthy level. Well, did that work? Are you not? Is the funk over? I hope it is. I mentioned, so Helen wants to know what over-the-counter brands I recommend. I've used Swanson for myself. We use vitamin D for kids with sickle cell disease in Nigeria. It works wonderfully, I have to say, wonderfully, surprisingly well. So Swanson I know works. But quite frankly, I got to tell you, vitamin D is not that difficult to make. I'm just trying to look at what I have here. So I get this from Sam's Club. The Sam's Club special vitamin D. Yeah, it is really not that difficult to. It's really not that difficult to make. So don't sweat it. Just focus on getting your 10,000 international units in the winter. I didn't say that. I said I tell my patients to take 12,000 international units. Someone says, Asaya Man says the D3 drops with K2 and Omega. That's even better. Yeah, that's good. That's even better than just the ordinary vitamin D. Can you take? Yes, you can take too much vitamin D, but I think doctors overestimate how easy it is. They underestimate how easy it is to overdose. The Mayo Clinic had on their website. They said overdose happens with vitamin D when people are taking over 60,000 international units every day for several months. That's when you can have overdose. And in other cases too, you're not going to have severe overdoses from the doses I'm recommending. Yeah. So I was going to say something. Can you have too much vitamin D? Yes. So it's possible to have too much of everything, of anything. But trust me, it's better to have too much. There's been no reported deaths, none that I know of. Maybe you know it, but none that I know of in which the person died from a vitamin D overdose. There are millions of deaths that have happened in people because they didn't have enough vitamin D. I promise you. And just remember, the lifeguards, people who stay out in the sun day in, day out, who are completely exposed to the sun, if they stay out long enough, they can make as much as, in some cases, 50,000 international units. Their bodies will make that much. If their bodies can make that much and they not die, then it means that there's something we're missing here. It means that that we are being alarmists over something that the body naturally makes. So that's my take on that. Should you take a vitamin D and vitamin K combination? What are your thoughts on Black postmenopausal women and vitamin K? Now remember, it's vitamin K2. K1 it helps with coagulation, but K2 is what helps with calcium tablets. I recommend K2. I mean, I have patients back who are taking in Nigeria who take the vitamin D3 K2 combination. If you can get it, you take them together. If you can't get it, you still got to take your vitamin D. You still got to take your vitamin D. So ideally is to have the combination and to use both of them, but do not use vitamin D because you don't have vitamin K2. So please, I want to make sure that you understand that. I'm a 77.2 level, so I can go higher. Well, that is Valerie. That is between you and your doctor, sir. I thought you were 76 before. Just a minute ago, you were 76. How come you jumped to 77 now? 10,000 per day. Linda says, thank you for your info on vitamin D. I do take it, but I've skipped some days in taking it. Don't sweat. Well, don't sweat it. I will continue to take it on a regular basis. I encourage you to do just that. A standalone vitamin D blood test is relatively inexpensive. Yeah, I think it's about $40, right? If anyone would like more information about vitamin D tests, please reach out. Cherie says, please reach out. Yes, reach out to Cherie, right. How do you balance sun exposure to get vitamin D, but well, avoid sun damaged skin cancer? Good question. So some recommend expose yourself to the sun when you begin to feel the burn. Don't stay after you feel the burn. Some recommend olive oil as opposed to sunscreen, because I think with olive oil you still get the benefits of vitamin D and you don't get the harmful chemicals that are in sunscreen. So that would be something worth, if you spend a lot of time outside, that would be something worth trying out. My experience is that most people don't stay out in the sun long enough in the first place to get that burn. So I think, and we have a much lower risk of having skin cancer. I started my training as a radiation oncologist, so we were dealing with a lot of cancers of different kinds, and the only patients we had that were black were people who are albino, those who don't have melanin pigments at all, because their skin was so, they didn't have the melanin is like a sunscreen. So they didn't have that protective factor. And the other ones who we treated with who had skin cancer, I honestly can't remember. I can remember very few who we actually treated who were fully black. Well, I mean, I don't mean by, but who are black, right? Who are black and who had skin cancer. It's just not common with black people. So it's less, not that it isn't something to be concerned about and to be cautious about, but it just isn't that common. Erica says vitamin D completely restored my memory. It completely restored my memory. Can you imagine what she's saying? Something as cheap and as simple as vitamin D could make the difference between memory loss, memory failure, and good health and good memory. That's just bizarre. I didn't know this in medical school when I was being trained. Neutrogena with zinc works fairly well with me. Okay, all right. That's for, I guess, Arinthia is saying that Neutrogena with vitamin C works fairly well with her. I guess that's as a sunscreen or something to protect from the sun. Hi, I have D3 1000 international units. Is this too low? Well, I think I've made my point. It increased my mood. So Anita said it increased my mood and focus too. How much is too much of vitamin D? What are the negative effects? So the main concern with vitamin D is that if you take too much, and remember, Mayo Clinic said 60,000 and above. I certainly don't recommend that, but I do recommend 10,000 for my patients. I've been using more than that for several years. The main concern is that your calcium levels could go up, and so you could have more calcium, high calcium levels, which is why sometimes I recommend vitamin K2. But if you've been low in vitamin D for a long time, which most of you are, there's really very little fear of having high calcium levels. So some people might have headaches, some people might have difficulty sleeping, but once they stop or they go off the vitamin D for a few days, they're better. So it's not the kind of thing that is going to stay in your system for months and months and months, and you're going to feel miserable for months and months and months. Some of these things are easily reversible. So again, it's better to err on the side of doing too much vitamin D than too little. And I know some people, they are so sensitive to vitamin D. So there are genetic differences. Some people are very, very sensitive to vitamin D. So if they take a small amount, they get, maybe they, like I said, they might have a headache, or they just don't feel right. They back off, maybe take a half that dose, and then they feel better. But you got to keep trying and testing and seeing what works for you. And don't give up just because the first time you tried it didn't work out. You should be taking vitamin D, especially, like I said, especially if you're over 40, you are overweight, and you are female. Yes, you're a woman. Okay. You can take, yes, absolutely. You can take magnesium with vitamin D. In fact, you should take magnesium with vitamin D. That's another thing you take. But I don't want to throw too many things at you. But vitamin D works even better if you have magnesium as well. But don't not take vitamin D because you don't have magnesium. Those side effects of the medications may be catastrophic to our blood vessels. Very true, very true. Some drugs are they're not entirely safe, but they have to be taken to control your blood pressure. Prenatal vitamins are a great source for supplemental vitamin D, etc. Do you recommend tablets over gummies? Gummies have sugar in them and all that, so I would say I take gel capsules. So I would say you want to reduce your sugar intake, find every possible way to reduce your sugar intake. So if I were to choose tablets over gummies, yes, I would definitely choose tablets over gummies. Stalina says, can high doses of vitamin D taken daily aid in increasing or balancing hormones when progesterone is low? Well, vitamin D certainly helps with the hormones. Can it help with making progesterone? It can, as well as it can help with making estrogen and testosterone. But I can't say anything more than that. Gina asks about vitamin B12. Absolutely, very important. We mentioned that last week. Very important. I eat not 3D pills. It tastes okay. I am not understanding that. Arjan Karel Johannes. I'm not understanding that. My physician, Peggy says her physician tests her D levels regularly. Good for your physician. What I've seen is that most physicians simply do not test that routinely. I think that's a mistake, especially for a physician not to check black patients, their black patients' vitamin D. I think that's unfortunate. They should. All physicians should check all patients' vitamin D levels, especially their black patients. How much vitamin K2 is recommended? What they usually, so the combination is usually 1 to 100. So if there's 10,000 vitamin D3 to about 100, so that's 10,000. Let me see, what's the ratio now? Man, my math skills are not what they used to be. 100. Okay, so 100 times. So if you're taking 5,000, you need 50 micrograms of vitamin D. So the ratio is 100 to 1. So 100 times what's your so you take 1 over 100th of what you would take in vitamin D3. So if you're taking 10,000, I take 10,000 international units a day at least. So I would take about 100 micrograms. And like I said, sometimes they come in a combination, so it's already sorted for you. Okay, first time of hearing of vitamin K2. What level is good? Okay, so I've kind of explained that. K2, yep, I've tried to explain that. The encapsulated form works better for me than the gel capsules. Research manufacturers and work with your pharmacy team. Thank you, Arinthia. Pierre Clark, glad to see this information. Very, very important information. Thank you, Gina. Thank you. I was told you are never at risk of having too much vitamin D. Not true. It is possible to overdose, Arinthia. It is possible to overdose with vitamin D3. What are the symptoms of vitamin D overdose? No nerve damage. Like I said, it raises the levels of calcium. That's the main issue, and so some people could have headaches or problems sleeping. Once they back off, their calcium levels can go back down. So it's not something that will remain as a toxicity in your system for a long time. Thinking about lifeguards, Beverly says, thinking of lifeguards out in the sun for large amounts of time. They would be wearing sunscreen and still producing vitamin D. Well, some of them may not wear sunscreen. Yeah, sunscreen blocks you from making vitamin D. If someone has dementia and starts taking vitamin D3, would their memory get better? I couldn't tell you. For some people it works, but by the time someone has dementia, you need they have more problems. They have much bigger problems than just vitamin D deficiency. So they would probably need a lot more than just vitamin D. And we, in my clinic, we actually address dementia and memory issues. I also do telemedicine, so I also consult online. But people, they have to sign a waiver, so to speak, saying that they understand that I am not practicing in the United States, which I am not. If someone who has dementia starts taking vitamin D3, would their memory get better? Okay, I've already discussed that. My husband started getting frequent night calls. My husband started getting frequent night calls. When I asked, he just waved off those calls as unimportant. At some point, I could take no more of his lies. I decided I deserved to know what is going on. Someone on here referred me to this man who helped clone his. Okay, all right, sorry. Can you speak to the difference between, there's no difference between, well, someone is asking, Beverly is asking, the difference between Alzheimer's and dementia. Alzheimer's is a subtype of dementia. So dementia is like the umbrella term. And dementia refers to problems with memory, problems with sometimes speech, problems with mood and behavior as a result of the brain deterioration over time. So it's what is known as a neurodegenerative condition, neurodegeneration condition, in which the brain is slowly, I don't want to use the word dying, but it's deteriorating, which results in problems with memory, speech, mood, behavior, and sometimes even movements. Alzheimer's disease is the most common type of dementia. About 70 to 80% of all dementias are Alzheimer's disease, or what is known as mixed dementias. So yeah, that's the difference. So when you say dementia, many times you're really talking about Alzheimer's disease. K2 is used to drive calcium into the bones and the teeth. It helps to regulate your calcium levels in the blood. But liquid D3 more potent than the gel capsules? Because it's liquids, it may be more, but like I said, I mean, it's potato, 6 or half dozen of the other, in my opinion. Do you need K2 with D3 for it to work? D3 will work. Most times D3 will work. But like I said, K2 certainly helps. So if you can get the combination, I would recommend you get a combination. If you can get if you take magnesium as well, that would be great as well. And so on and so forth. Kimberly says, how do I contact you? Okay, so I'm going to put my email here. David.wordquest is my email address. david.wordquest@gmail.com. There you go. I'll put that in the comments below. Okay. K2 explanation. Thank you. Omega fish oil tablets are very helpful with memory. Yes, the brain needs omega-3s. A huge percentage of your brain is made up of fats, and of that fat, omega-3s, especially DHA, constitute a very large proportion. So yes, very important. What's the difference? Thank you, Anna. What's the difference between D2 and D3? D2 is from plants, D3 is from animals. In my opinion, and the facts bear this out, that D3 is more bioavailable, and there's less danger of having toxic buildup or toxicity with D3 D3 than D2. So D3 is a more natural, more bioavailable one, more than D2. Unfortunately, D2 is what doctors prescribe, whether injection form or in pill form. And they tend to recommend it on a weekly basis. The research says that daily is better, and you got to take D3. And besides, D3 is cheaper anyway. It's when a doctor prescribes vitamin D, it's usually D2, and it's usually much more expensive than the D3 you can get over the counter. What's the difference between Alzheimer's disease and Lewy body? So Lewy body is like Parkinson's kind of disease, Parkinson's dementia. It affects about the same areas that are affected in Parkinson's disease. You have more hallucinations, you have delusions, you have these aberrations in which you're seeing things, you're hearing things that are not really, so like I said, illusions and hallucinations. And it also affects balance and so on. But Alzheimer's disease is more like memory and more like processing, the ability to understand what's going on. Sometimes people who have Alzheimer's disease, they think they have hearing problem and they want to get hearing aids. But the truth is their brain is not processing information like it used to. And so they are hearing things, but they're not able to understand them because their brain isn't processing. They think that they are not actually hearing what the person is saying. No. The truth is that they are actually not able to process what the person is saying. So getting a hearing aid will not solve the problem. Now, having said that, one of the risk factors for dementia is having persistent hearing loss or diminished hearing over a period of time, especially in middle age. So in your 40s and above, it happens in your 40s and above. That can predispose to dementia. So if you can correct hearing loss before it becomes dementia, you can actually stave off dementia if you can correct it in time. You can correct hearing problems. Okay, I hope that makes sense. Okay, Beverly says this presentation has been so informative and insightful. Well, thank you, Beverly. Colette, Atlanta, Georgia. Hey there. If you're allergic to shellfish, can you take omega-3s? The omega-3s is mainly in fish, not necessarily shellfish. So I would say, technically you should not be allergic to fish if it's just shellfish you're allergic to. So I would say proceed with caution. What do I think about lion's mane? Lion's mane, I think I think that lion's mane is like a mushroom. It's like a plant that's supposed to have some brain health healing properties. I haven't used it before, but I've heard some good things about it. So I can't really tell you what. So increasing vitamin D3 will help turn this around. I don't know what this is referring to, but if you're talking about dementia, I'm not saying that vitamin D3 will turn dementia around. So I think I've made that clear. It is not going to turn dementia around. It will help. And no matter what you do, I would say, no matter what you do, no matter what treatment you get, you need to be on vitamin D, and you need to make sure that your vitamin D levels are optimal. And as I said, in my opinion, I would not accept anything less than 60 nanograms per mil, which is the blood level of the vitamin D3. I would not accept anything less than that for my patients. Okay, very informative, very informative. Okay, all right. Okay, what about CMOS? I don't know what CMOS is. Okay, well, this has been great. I want to thank you all. I want to thank you all for joining us today. If you have any questions, like I mentioned, you can go to. There's a vegan omega that can be taken. It contains algae. Okay, all right. Yeah, I'm just going to have to end this here. Okay, thank you all for joining us today. Remember, you can go to our YouTube channel, and you'll see some videos there. And please reach out to us if you have any questions. By the way, if there are any specific topics you want to talk about, let me just take this next few minutes before we close If there are any particular topics you want us to discuss, please go ahead and type it in here, or go to our YouTube channel. I've typed it in there. I can type it in. It's dr. David Ajibade, my last name, and then you can send us a message there, because we're really beginning to ramp up for 2024. and want to really provide great content and address great content. I just think vitamin D3 is such an important topic, so I'm very I'm keen on addressing dementia in Black people. Can you post link to YouTube channel before you close out? Okay, I want to do it. I will do that. Hang on just a minute. Let me just stop sharing. Okay, I want to get that link to the YouTube channel before I go out. Let's pick here. Okay, I'm going to just put that there, and of course, you guys can reach out to us. Okay, so I'm posting the. Okay, all right. Thank you for these topics. Let me go back up and see. Keloid. Someone says keloid. Someone says endocrinology health. Yes, hypothyroidism, menopause, deficiency after bariatric surgery, fibroids. Thank you. Informative. Okay. All right. Balancing women's hormones. Very important topic. Balancing hormones. Oral health is connected to heart. Oral health is connected to heart health. Okay. Okay. I'll just get this. I'll probably get these afterwards. All right, folks. Thank you so much again for joining us. Have a wonderful weekend, and God bless.